The number of coronavirus cases in the United States has officially topped 3,700 with 69 deaths. As government officials close schools and mandate closures of bars and restaurants, the Centers for Disease Control is recommending the cancellation of all in-person events of 50 or more people for the next 2 months. That means everything from sporting events and festivals to weddings and beyond. Joining us right now is Dr. Scott Gottlieb. He is the former FDA commissioner. He's also a CNBC contributor, and he serves on the boards of both Illumina and Pfizer. Scott, you've been kind of guiding us through this almost every day. Where do you think we stand right now?
Well, I think right now, we're about 6 weeks. We're about 2 weeks into the process between when China first identified community spread and then you had the lockdown of Wuhan. I think the difference for us is that we identified our community spread much earlier than China, and I think we're starting to take mitigation steps much sooner than they did. China did just about everything wrong during those 6 weeks. I think we're doing a lot of things right currently, notwithstanding the challenges we had getting the diagnostic tests deployed, which will be fully deployed, I think, this week. I think by the end of the week there's going to be much more diagnostic screening. I think the steps that the governors are taking right now, which are very aggressive, are going to absolutely impact the trajectory of this epidemic. I think we need to continue to do that. We need to have a difficult March so that when we get into April, this peaks out at some point in April. And if you talk to some of the folks who are modeling this, there is a sense that this is likely to peak sometime in mid to late April, and heading into May we'll be coming down the epidemic curve. And the goal right now is to keep the infection rate as low as possible at any one point in time, so we don't exhaust the healthcare system, so we don't start having more deaths as a result of the coronavirus. I
think we need to emphasize what you just said. You expect this to peak in late April to mid-May. I mean, that's longer than probably a lot of people in the American public are expecting at this point. Lots of us are being told our schools are closed for 2 weeks. That doesn't sound like a realistic goal if what you're saying is right.
Well, I think the schools are going to end up closing for longer periods of time. I think they're announcing 2 weeks at a time, and they'll reevaluate the situation. In certain districts where there might not be community spread or evidence of community transmission, schools might make a decision to restart, although I think it's unlikely. But that's a good case scenario. This is going to be a 6 to 10 week process, and I think if we can get through this in 6 to 8 weeks and keep the peak of the epidemic below the point at which the healthcare system gets exhausted. If you look at what happened in South Korea, Italy, China, that was about the length of time that it took the epidemics to run the course. South Korea is much more successful at keeping the peak number of infections down. Italy is obviously losing control of their infections right now and of their epidemic. I think what we need to do is focus on how do we blunt the impact of the mitigation steps that we need to take to try to reduce the community transmission, things like closing schools, closing restaurants, closing bars, places where people go. So you basically slow down activity and people self-quarantine because they have no place to go.
It's business as usual for the moment, but of course we are talking about 12 midnight Eastern time tonight, local time here in London, 4 a.m. Tuesday, and then that's it for transatlantic travel pretty much. In fact, in the other direction, the UK government has said all but essential travel to the US should not be carried out anywhere as well. I mean, just behind me, travelling out of Terminal 2 at Heathrow, you've got United Airlines, you've got American Airlines, you've got Delta, and they've all come up with some pretty drastic cuts in the last 48 hours. Delta cutting 40% of flights, grounding 300 planes. You've got American Airlines cutting 75% of international flights. United are cutting 50% of flights for the next 2 months. They've already, in March, carried 1 million passengers less in the first 2 weeks than they would normally carry as well. And quite frankly, it's a bloodbath on the airline industry as well. IATA, which is the global airline travel group as well, reckons already it's $113 billion of lost revenues for the airline industry this year. And that's, I think, maybe a figure that's even out of date already. Heathrow, as you all know, is one of the biggest airports in the world. It is the second biggest international airport in the world. Normally carries about 80.8 million passengers. But we had a clue in their February numbers about how bad things can go. February passenger traffic was down around about 5%, but the APAC travel, i.e. Asia Pacific, that was down 30%. And I guess now, when we see the March figures, it's going to be far more devastating kind of numbers than that as well. In terms of what the airlines are saying, well, British Airways, the biggest carrier, of course, here in the UK, biggest carrier out of Heathrow. They pretty much dominate one of the terminals here, Terminal 5, as I'm sure many of our international audience realise. They have said this is an existential crisis. They will be grounding flights like never before. Another one of the big transatlantic carriers, Virgin Atlantic, the CEO, Shay Weiss, has been talking about the need for governments to get involved, and this could be very contentious over the medium term. Short term, of course, it's about keeping these carriers alive. Shay Weiss, CEO of Virgin, saying, look, for the British airline industry, they need £7.5 billion worth of support straight away. That is trying to keep these flag carriers going. And we've just heard from Ryan Air's Michael O'Leary. He's kind of like the southwest of Europe as well. Listen to this. They've just come out and said for April and May, they will cut, Becky, 80% of their capacity. That's an 80% capacity straight away for April and May.
Well, if we do what we're supposed to do, we really should look more like China, and hopefully even one of the countries that are doing a little bit better than China. Basically, what you know, your viewer is pretty savvy, so they're used to watching graphs, and they see this flattening the curve graph, and I don't know if they really understand what we're trying to do here. So if you look at a curve on a graph, you know, you're going to see a spike, and then you see a line that actually goes kind of flat. And basically what social distancing is trying to do is to decrease the amount of people infected at one time under the curve. So bear with me here, understand. What's going to happen is if you had 150,000 people, that's the spike that would be infected. That's the spike. What we're trying to do is instead of having 150,000 people sick at one time, which would overburden the medical system, we'd rather have 10 people sick, or 10,000 people sick rather, over a longer amount of time. So 15 days. Making sense? So we don't overburden the system that is already overburdened. So at the same amount of area under that curve, whether it's flat or it's spiked, still 150,000 people, but we want them to be very stratified as opposed to at one time. And that's what social distancing does. Social distancing makes it so that everybody will be exposed, who will get exposed over a longer period of time as opposed to one moment in time. And so that makes the system able to handle that capacity. We know public health is a four-legged stool. Basically, it's public outcry, it's politics, it's economics, and then it's science. Most of the time, those top three rule the day, and science is probably at the bottom because people get very upset and they get nervous and they get panicked, which, just to let you know, increasing panic increases cortisol, which is a steroid, which also makes your immune system worse. So the more you panic, the more you're apt to get the disease. But we want science to rule the day. And what we know is when we look under those curves, science will state, because of the infectivity of this virus, that the amount of people will be decreased if we quarantine, if we keep people from having big social gatherings. And that's what we need to be doing.